Oftentimes, anxiety and depression are not recognized very well by family members and by teachers. They expect teenagers to be more challenging, more moody, more difficult. In teens, anxiety and depression presents somewhat differently. If there are signs of withdrawal from activities and friends, spending more time in their room, irritability, grades dropping, poetry writing that seems to be dark, if that lasts for more than 2 weeks, that's a sign of depression. We tend to see irritability and agitation. If your teen describes symptoms of their heart racing, sweaty palms, feeling as though the world is closing in on them, that's more of an anxiety attack, and to really pay attention to those. If your teen tends to have more than 1 or 2, it would be very beneficial to seek professional help. Some factors can be traumas such as sexual abuse and physical abuse, family conflict, parents going through a divorce. We have seen a significant rise in anxiety and depression in the last 5 to 10 years. And some of it has a lot to do with social media. There's the opportunity for cyberbullying, which is very hard for parents to control and be aware of. I think in some ways cyberbullying is significantly more powerful than regular bullying because words or pictures are put on social media for everyone to see, and it leaves a permanent, visible mark. Family therapy is oftentimes a very helpful choice of treatment to reach teens because it helps them to feel listened to by their parents, and it helps them to feel understood. It's not a matter of blame or accusation or judgment. It's a matter of what can we do together to work together to help their teen feel better. And group therapy is a wonderful modality through which teens can connect with other teens, and they can really see that they're not alone, and they're able to piggyback off of each other in order to deal with their anxiety and depression and learn coping skills. If a teen does need medication to address anxiety or depression, the therapist would work alongside the psychiatrist, making sure that information is shared and that they communicate effectively to get the best result for their teen. When parents grew up, things were a lot simpler and much easier. We're living in a very unsafe world where teens are very much aware of terrorism and uncertainty in the world. That impacts them. There's more pressure on grades and getting into college. And these are important factors to take into account. If teens are experiencing anxiety or depression and they do not receive help, it has the potential to lead to increased anxiety and depression. And one of the risks that we really don't want to ignore is the potential for suicide. I think that no parent wants to take that chance of seeing their child get worse without help. The answer to that is no, and it's important to engage with a therapist and develop a treatment plan. What the treatment plan will include is the goals of therapy and a time frame for how long this will realistically take to achieve the goals that are set. The benefits of therapy are significant for teens. One of the first benefits is feeling better about themselves, having a stronger sense of who they are and what their goals are in life. Additionally, therapy teaches teens coping skills and strategies for how to help them get through rough times, how to help them deal with anxiety in school situations, in social situations. Therapy most definitely helps both teens and families to have a more positive relationship. As a therapist, I know that going through the teenage years is a very tough time, and to have a support system is extremely helpful. If you are a parent and you have questions about seeking professional help for your teen, I would recommend finding a therapist that you can speak to on the phone and have some relevant questions that you may want to ask them that will help you determine whether therapy is a good fit for your teenager.